Hi, I'm Dr. Itri at Studio Aesthetics and Wellness, and for this session, I'm going to talk about testosterone supplementation in women. So it turns out that testosterone is essential for the mental and physical well-being of a woman, just like it is for a man. In women, testosterone peaks around the ages of 18 to 24 and then gradually declines. And usually around menopause is when you have abrupt cessation of testosterone, and that's when women start to present with low T symptoms. The information I'm going to share with you is based off of large-scale clinical trials in human beings. Testosterone supplementation has been done since the 1930s, so there's decades of research supporting the things I'm going to tell you about the benefits of testosterone supplementation. So, number one, it improves libido and desire. It's the same thing between men and women. We know that's a major function of testosterone. Number two, it can be used to help with moodiness and irritability. So your typical PMS type symptoms, testosterone supplementation can actually ameliorate those. Testosterone is protective against depression and anxiety. So if you look at women, age-matched women who are low T versus supplemented with T, the women who have low T have a higher incidence of anxiety and depression. So we already know baseline levels of anxiety and depression are twice as much in women as in men to start with. So this is an important effect of supplementation. Testosterone supplementation is also protective against breast cancer. If you looked at age-matched controls, women who are low T have a higher incidence of breast cancer than women who are supplemented into physiologic dosages of T. It's actually one of the only FDA recommended reasons to give a woman testosterone is the palliative treatment of breast cancer because it's effective against breast cancer. Testosterone supplementation can actually lead to bone remineralization. So anyone who's osteopenic or osteoporotic, you can get 5 to 8% more bone mineral density over the first year of testosterone supplementation. And that's a great treatment for that kind of disease process. We know it can be used to treat certain types of migraines. You have migraines related to low testosterone, you have migraines related to low estrogen. Both of those can be helped by hormone supplementation. We know that testosterone contributes to lean muscle gain and facilitates fat loss. And one of the most common scenarios we have is we have a patient come in who says she hit a certain age, put on weight, couldn't take it off, or she hit menopause, put on weight and couldn't take it off. So we have a conversation about semaglutide, but we also talk about hormone replacement because that's a likely contributor to her inability to get that weight off again. We know that testosterone supplementation can reduce your triglycerides, cholesterol, and lipids. More importantly, it decreases cardiovascular risk. So in both men and women, unopposed estrogen has pro-inflammatory effects. It can increase your risk of things like heart attacks. So when you look at both men and women who get testosterone supplementation back into physiologic levels, they've got a reduced cardiovascular risk, and that's a major benefit. So I hope you found that helpful. If there's anything else you'd like to hear about, any questions you have, any topics you'd like to hear discussed, send that to us, send us an email, send us a post, and we'll be happy to put that together. Take care.